Hello, YouTube family. This is Ebony back with another video. No longer Hummer I, but I'm still around. I'm just want to kind of update you guys with this coronavirus. I know everybody's talking about it, but I have two dear friends that are nurses, and I would like to introduce them. But we are keeping their names and their faces and everything anonymous. So we will have different names, but you guys will get a chance to get some first-hand information concerning what's going on inside the hospitals, okay? Because this is a very important thing that's going on, and it's a lot that needs to be discussed, okay? And this is Arkansas. Okay, I am introducing my anonymous interviewees. Please introduce yourselves.
Hi, I'm Crystal.
I am Nicole.
So tell me, I know you both work in the medical field. What is it like being a nurse in this time, during this time?
For me, I would have to say that it's very interesting. You go into work, you grab your, before you can even clock in, you have to get your temperature taken, you have to answer a questionnaire, just to see how you're feeling, if you have a sore throat, if you,
I mean, are you guys like
A
nervous?
runny nose, anything like that.
yeah, if you have any symptoms,
Potential respiratory symptoms.
then you are sent home from work. I think you still get paid 2 hours work for coming up there for showing your face, but for the most part you get this surgical mask and you wear it, wear it all day long and you just tend your patients. I mean, that's pretty much what it is.
I mean, it's business as usual plus a small added precaution.
Yeah.
I don't know about one thing about the mask that we don't have enough.
Yeah. So if anybody has some, please donate them.
Please donate them to
any
the
hospital by you.
We don't have enough. So a single-use mask that normally you would wear into a room, which I work with patients who have had an organ transplant, and anytime you walk into their room, you're supposed to have a brand new mask.
Mm-hmm.
But what's happening is we're actually wearing the same mask for an entire 12-hour shift.
Yeah.
Okay, let me reiterate that, Jane. You're saying that.
Nicole.
Oh, I'm sorry, Nicole. I'm sorry. I've just had a glass of wine, so let me recoup from that last drink. But so you're saying that you guys don't have enough masks, and you actually having to recycle masks that you've already used and use it again?
Yes.
Yeah.
I mean, how is that protective of the coronavirus if that's going on?
It's potentially not protective at all. Once it gets soiled, if we cough or sneeze into it, if it gets wet, if it gets just condensation from our breath, it's not actually useful anymore.
So you might as well just go in there with nothing.
Yeah, pretty much.
And because of the shortage, the CDC is now saying we can use bandanas or just basically whatever we can find, and that's acceptable, which does not protect us from anything at all.
And I mean, I can see both sides of it. I do understand why the hospital or clinics are doing it for their employees, just to hopefully provide them something. But the real question is, I mean, is this droplet? Is it airborne? I mean, what is it?
And that's the problem. Nobody really knows. So we don't know what to do with it.
Yeah.
So I know you guys have loved ones, and I know y'all have families, and you all have elderly in the family. And I know one of you had to share with me about you have an elderly person that was in a facility that had 46 cases, and you're very concerned about your grandfather. So can you express with me about that and share with everyone how you're feeling about that? And please state your anonymous name, please.
I'm Crystal. It is very sad because I really don't know. I don't know how it got in there, basically. So I understand everyone's taking precautions to wash your hands and don't sneeze around people and all that stuff. But which, in a way, I feel like it can happen anywhere. Like at that facility, it can happen there. It can happen at any hospital. It can happen at any clinic. I mean, we just have to be proactive, I guess you could say. So I'm just hoping and praying that my loved one does not get the Rona.
And what about you, ma'am?
Ma'am,
Say your name again.
Nicole.
Okay, Nicole.
So of course, I have my grandparents, and I have an uncle who has been battling cancer. So his immune system is definitely not great. But I also have my sister. She has Lyme disease, so she has an autoimmune disease. She also has rheumatoid arthritis. So she has a lot of factors that put her at higher risk. So I'm not even able to like go and see my sister or my grandparents, and that's okay because I would rather not see them for a while and then come out of this okay. But it is hard knowing like you can't. I FaceTimed my sister today, but that's all I can do until this is over. That's all I can do, and that part is hard because I don't know what I've been exposed to going into the hospital every day.
Yeah.
Because I'm not just on my little isolated floor. Like I move around. I'm in different places.
Getting on an elevator. I mean,
Yeah.
Going to cafeteria.
Everything.
Apparently, it attaches to your clothes. So
I was.
You know.
So it's kind of like it's really hard to. I mean, from what I can hear and what I'm gathering, it's really hard to so-called be protective if it can attach to anything. I mean, whether you wearing gloves or mask or not. I mean, you're still really not protected.
Yeah, I know. Like when I get off work, I go straight to the shower.
Same.
I put all my clothes in hot water and go straight to the shower, wash my hair, and wash everything.
Yep. And that's it. And my concern is not that I'm gonna get it, because if I get it, I'm young and for the most part, I'm healthy.
Yeah.
As far as I know. So chances are I would go home and I would just ride out the sickness, and it would really suck for a few days, but I would be okay. But if I were to pass it along to one of those people
There's no
that doesn't have a good immune system, I mean, there's no telling. So my fear is not that I will get it, but it's more that I will give it to someone.
And see, that's how I feel. I'm not quite as young as you guys, but I'm fairly healthy, and I have a concern. I try to think about other people. I wouldn't want someone else to catch something if I had it. That's why I practice social distancing. Am I saying it correctly?
Yeah, but really, I mean, I don't like the term social distancing because, I mean, you still have people going around town in the grocery store, getting gas, going to these restaurants, and like the restaurant people, they give you your food, but they have on gloves, so they keep those same gloves on, give you your food, go to the next person, get in their food. So I mean, you're still at risk of getting it, basically. I don't know. I don't really like the term social distancing.
Yeah, when I said that too, it's kind of like, am I saying this correctly? Distancing.
Well, I think like if they want us to really follow that guideline, the term social distancing, it sounds very light. I feel like it almost makes light of a situation that could potentially become something bigger because they don't want to use words like quarantine or shelter in place, which.
And I get it. People are tired of sitting in their house all day watching TV. I know these parents are tired of watching their kids all day, teaching them schoolwork. And I know people are tired of losing out on money, not being able to work. I know it's hard on everybody. But hopefully, if we can just bunker down and get through this, here soon, hopefully.
And my thing is, like, obviously we're here, we're socializing right now. But to an extent, like, my opinion, certain people, for me, it's kind of safer to be around, like people who work in the public, in the hospitals. Like, we work in the same hospital, so essentially what I've been exposed to, we both have.
Well, I mean, what about me? I mean, you guys are visiting me because y'all were checking on me to make sure I was good, which I greatly appreciate.
You also work with the public.
Yeah, I work with the public, but I have been blessed with a position that I can work from home, and to keep me from being exposed so much, and I'm very, very thankful, and I still get paid, and because there are a lot of people out here that don't get that.
Yeah, and I feel like we have common sense. Just like that one person was trying to come visit. You just got off a plane from Washington. No, thank you.
I agree.
Washington, that is ground zero.
No.
But no,
you gotta have common sense.
Also, I think we potentially have been exposed to things.
Yeah, of course.
But there's a big difference in me coming here to see you and me going to see my 80-year-old grandma.
Yeah, I agree. You know, I feel the same way when I'm gonna go see my parents. I tried to, you know, stay with my mom as much as I wanted to. I'm not gonna lie, I gave her a kiss on her forehead. But yeah, I couldn't resist mom's cute forehead. But yeah, it's hard. It's hard. You know, I've been FaceTiming my mom and my, you know, my people, but it's, you know, sometimes you just want that human connection.
Well, that's part of being humans. We want that connection. We want that. We want it face to face. We crave touch and just interaction with other people.
Well, how do you guys feel about people that don't respect that just out here thinking they're just, you know, they can do what they want to do and just disregarding everybody else's health, you know?
Like the spring breakers?
Exactly, the spring breakers.
Well, you gotta think about it. I mean, people are gonna do what they want to do anyways. I mean, there's nothing we can do about it. I just have to be like, stay away from them, I guess.
Yeah.
Well, I think it's stupid.
Okay, do you guys think that there's a possibility of a person catching it and then the strain changing?
Absolutely.
And then we're probably carriers now and don't even know it. We may not even be showing symptoms and just sitting there carrying it around, but we don't know it. I mean, children are carriers, basically.
Yeah.
So,
The thing is, like, there have been other strands of coronavirus, but the COVID-19 is the one that has come out and just decided to just run rampant throughout society, throughout the world.
Yeah.
So, yeah, it will. I think it will definitely evolve, just like most viruses do.
Yeah.
This is probably not, I mean, I don't think this is going to be the end of it.
No.
Once we get through this phase this year.
And of course, when it gets winter and stuff again, something else is going to pop up, I'm sure. But you just have to, I don't know.
Well, you know, you guys, this is 2020. Of course, this is not something that we expected. So do you guys, how y'all think this year is going to go? Do you think things are going to get better? Do you think things are going to turn for worse? We're going to get something else going to happen right after this? What are some of you guys' predictions?
I personally think by summer, which I mean by summer, I mean like June, I think it'll be all over. That's just I feel like it'll be over with, but of course, you know, something else will probably pop up here in a year or two, but that's just my opinion.
My opinion is it's going to get worse before it gets better, but I don't think it's going to be a long and drawn out thing.
No.
I think we're going to have this peak, this spike, which is coming in phases kind of throughout the country. We're not all getting hit at once with it because, I mean, we're big and we're spread out, but I think we're all going to have this little spike, and then I think it's going to die down within the next few months, and I think life will start to return to normal. But my only concern with that is, like, we haven't seen, because, like, China, they're starting to, like, reintegrate themselves back into society, but we haven't seen what happens after they get back out there. Like, is it going to come back in another wave, or is it really gone for now? Like, we just don't know yet.
And my thing is, why are they just focusing on Italy? I mean, there are so many other countries in the world. Why is your main focus on Italy? Which, I did Google this morning that their numbers were significantly lower today.
Oh, that's good.
Yeah. So it's slowly but surely getting better in Italy.
But they have also been practicing very diligent, like, not just social distancing, but
they've been
shelter in place.
quarantined.
They have been
they've been actually quarantined. Yeah, and yeah, I've noticed that about Italy as well. So that might be why their numbers has gone down.
I mean, it works. The less interaction we have with other people, the less we're going to spread it.
I don't know about that.
Well, my thing is, I'm wondering, you know, just like HIV and some of the other viruses, if there's a possibility that if the strand changes, if they come up with a cure for the virus, that it won't work because the strand changed. And then also I'm thinking about what if, you know, depending on the person, the strand is different on each person. Upon a person, it might not be the same on you. They could be on me or someone else.
Well, they're working on vaccines right now, and it's kind of like a flu vaccine. It's not going to be a cure, but it's also going to be something that every year for now and forever, it's something they're going to have to work out every year to create a vaccine that they think might work. And some people have the option to get it. Healthcare workers are going to be mandated to get it, and it may.
Mandated.
Well, I mean, we have to get it. Where the flu